It's tingling, or a pins and needles feeling around the mouth.
Around the mouth, huh?
Yes. Or paresthesias, similar tingling or numbness, but in the fingers and toes. Muscle cramps are also very common.
Just general muscle cramps.
They can be anywhere, but often in the legs and back. And sometimes you might actually see something called carpopedal spasm.
Carpopedal spasm.
Yeah.
What's that look like?
It's a visible involuntary contraction. The hands might curl inwards, fingers straight but flexed at the knuckles, thumb pulled across the palm, and the feet might point downwards and inwards. It's quite distinct.
Wow, okay. That sounds pretty uncomfortable.
It can be. And if the calcium drops even lower, the symptoms can become much more serious. We're talking about tetany.
Tetany. Isn't that like a sustained muscle lockup?
Exactly. Sustained, often painful muscle contractions. And potentially life-threatening issues too, like laryngospasm.
Laryngospasm, what's that?
That's where the vocal cords spasm shut. It can block the airway, causing difficulty breathing, maybe a high-pitched noise called stridor. It's an emergency.
Yikes. That sounds terrifying.
It is. And seizures can happen too because the low calcium makes nerve cells, including those in the brain, overly excitable.
Seizures too. Gosh, what about other parts of the body? Does it affect the heart?
Yes, absolutely. Low calcium can affect the heart's electrical activity. On an ECG, an electrocardiogram, you might see something called a prolonged QT interval.
Prolonged QT. I've heard that's a risk factor.
It is a significant risk factor for potentially dangerous heart rhythms, arrhythmias. Low calcium can also cause low blood pressure, hypotension, and in really severe or chronic cases, it can even contribute to heart failure.
Okay, so muscles, nerves, heart, anything else?
Yeah, there are other effects too. Many patients report psychiatric symptoms, things like anxiety, depression, irritability, even problems with concentration and memory, sometimes called brain fog.
Brain fog. That makes sense if the nerves aren't firing right.
It seems related. And then there are changes you might see more gradually over the longer term. Things like dry, scaly skin, brittle nails, sometimes hair loss.
Yeah.
And importantly, cataracts can develop in the eyes. That's a well-known long-term consequence of chronic hypocalcemia. Also, dental problems like enamel defects or teeth erupting late, especially if the condition started in childhood.